Hi, welcome to my program. This is Dr. Jaime Daniel, and today I want to share with you an overview of Pemphigus. It is a disease that causes blistering of the skin and the inside of the mouth, nose, throat, eyes, and genitals. Pemphigus is an autoimmune disease in which the immune system mistakenly attacks cells in the top layer of the skin and the mucous membrane. People with the disease produce antibodies against desmoglins. They are proteins that bind skin cells to one another. When these bonds are disrupted, skin becomes fragile and fluid can collect between its layers, forming blisters. There are several types of pemphigus, but the two main ones are Pemphigus vulgaris, which normally affects the skin and mucous membrane, such as the inside of the mouth. Also, Pemphigus fusarius, which only affects the skin. There is no cure for Pemphigus, but in many cases it is controllable with medication. You are more likely to get Pemphigus if you have certain risk factors. While Pemphigus occurs across ethnic and racial groups, some populations are at greater risk for certain types of the disease. People of Jewish, Indian, Southeast European, or Middle Eastern descent are more susceptible to Pemphigus vulgaris. Pemphigus vulgaris is the most common type worldwide, but Pemphigus fusarius is more common in some places, such as certain rural regions of Brazil and Tunisia. Women get Pemphigus vulgaris more frequently than men do, and the age of onset is usually between 50 and 60 years old. Pemphigus fusarius generally affects men and women equally, but in some populations women get the disease more frequently than men do. While the age of onset of Pemphigus fusarius is usually between 40 and 60 years old, in some areas symptoms may begin in childhood. Scientists believe that the higher frequency of the disease in certain populations is partly due to genetics. For example, evidence shows that certain variants in a family of immune system genes called HLA are linked to a higher risk of Pemphigus vulgaris and Pemphigus fusarius. In rare cases, Pemphigus has resulted from taking certain medicines, such as certain antibiotics and blood pressure medications. Medicines that contain a chemical group called thiol have also been linked to Pemphigus. Rarely, the development of a tumor, in particular a growth in a lymph node, tonsil, and thymus gland, can trigger the disease. There are two major forms of Pemphigus, and they are categorized based on the layer of skin where the blisters form and where the blisters are found on the body. The type of antibody that attacks the skin cells also helps define the type of Pemphigus. The two main forms of Pemphigus are Pemphigus vulgaris and Pemphigus fusarius. Pemphigus vulgaris is the most common type in the United States. Blisters form in the mouth and other mucosal surfaces, as well as on the skin. They develop within a deep layer of the epidermis and are often painful. There is a subtype of the disease called Pemphigus vegetans, in which blisters form mainly in the groin and under the arms. Pemphigus fusarius is less common and only affects the skin. The blisters form in upper layers of the epidermis and may be itchy or painful. There are some other rare forms of Pemphigus, like paraneoplastic Pemphigus. This type is characterized by sores in the mouth and on the lips, but blisters or inflamed lesions usually also develop on the skin and other mucosal surfaces. Severe lung problems may occur with this type. People with this type of disease usually have a tumor, and the disease may improve if the tumor is surgically removed. Immune globulin A pemphigus. A type of antibody called immune globulin A causes this form. Blisters or pimple-like bumps often appear in groups or rings on the skin. There is also the drug-induced pemphigus. Certain medicines, such as some antibiotics and blood pressure medications, as well as drugs that contain a chemical group called a thiol, may bring on pemphigus like blisters or sores. The blisters and sores usually go away when you stop taking the medication. Pemphigoid is a disease that is different from the pemphigus but shares some of its features. Pemphigoid produces a split where the epidermis and the underlying dermis meet, causing deep, rigid blisters that do not break easily. The main symptom of pemphigus is blistering of the skin and in some cases the mucosal surfaces, such as the inside of the mouth, nose, throat, eyes and genitals. The blisters are fragile and tend to burst, causing crusting sores. Blisters on the skin may join together, forming raw-looking areas that are prone to infection and that ooze large amounts of fluid. The symptoms vary somewhat depending on the type of pemphigus. For example, pemphigus vulgaris blisters often start in the mouth, but later on they can develop on the skin. The skin may become so fragile that it peels off by rubbing a finger on it. Mucosal surfaces such as those of nose, throat, eyes, and genitals may also be affected. Blisters form within the deep layer of the epidermis and they are often painful. In the case of pemphigus flaccus, only affects the skins. Blisters often appear first on the face, scalp, chest, or upper back, but they may eventually spread to other areas of skin on the body. The affected areas of skin may become inflamed and peel off in layers or scales. The blisters form in the upper layers of the epidermis and they may be itching or painful. Pemphigus is an autoimmune disorder that happens when the immune system attacks healthy skin. Immune molecules called antibodies target proteins called desmogleins, which help bring neighboring skin cells to another. When these connections are broken, skin becomes fragile and fluid can collect between layers of cells, forming blisters. Normally, the immune system protects the body from infections and disease. Researchers do not know what causes the immune system to turn on the body's own proteins, but they believe that both genetic and environmental factors are involved. Something in the environment may trigger pemphigus in people who are at risk because of their genetic makeup. In rare cases, pemphigus may be caused by a tumor or by a certain medication. There is no cure for pemphigus, but treatment can control the disease in most people. The initial goal of treatment is to clear existing blisters and help prevent relapses. Treatment typically depends on the severity and stage of the disease. Symptoms of pemphigus may go away after many years of treatment, but most people need to continue taking medication to keep the disease under control. Treatment for pemphigus may involve medications like corticosteroids, immune suppressants, biologic response modifiers, antibiotics, antivirals, and fungal medications. If one of those treatments do not work or pemphigus is severe, Other treatments may be considered, for example, plasmapheresis or immunoadsorption, which remove damaging antibodies from the blood, intravenous immunoglobulin therapy, in which you are given pooled antibodies from 1,000 or more healthy blood donors. Be sure to report any problems or side effects from medications to your doctor. In some cases, a person with pemphigus may need to be hospitalized to treat health problems that the disease or its treatments can cause. Widespread sores on the skin can result in dry irritation or infection, and painful blisters in the mouth can make it difficult to eat. In the hospital, you may be given an intravenous to replace lost fluids, to get much needed nutrition, and to treat infection. Blisters in the mouth may make brushing and flushing your teeth painful, so talk to your dentist about ways to keep your teeth and gums healthy. Avoid foods that irritate your mouth blisters. Your dermatologist may recommend bath and wound dressing to help heal the sores and blisters. Pemphigus and its treatments can be debilitating and cause lost time at work, weight loss, sleep problems, and emotional distress. A mental health professional or a support group may help you cope with the disease. Remember to follow the recommendations of your healthcare provider. Well, I hope you enjoyed this episode, and we will see you in the next one. Thank you.